7, 6, 5, 4, 3, 2, 1.
Good afternoon. Thanks for tuning in to this week's episode of Hello Health. My name is Matt Law with Health Benefits Associates, and we've got a great presentation today with Dr. Sharon Wright at Western Surgical Group. She'll be talking about parathyroid disease. And before we get into it, I want to go through a few things. First off, this YouTube channel has presentations with other doctors in the future through the Hello Health series. We talk about preventative care, specialty care, all sorts of topics to keep you healthy and in tip-top shape. That'll be going on for the next few months. We also have more videos, more live presentations towards the end of the year through the Mastering Medicare series, where our Medicare experts, including myself, will be talking about the top tips and tricks to get you ready for the annual enrollment period. Then I will be kicking us off on September 15th. You can see the schedule off to the right-hand side of the screen. We have a few months before we get into that, and I want to focus on today's topic because parathyroid disease is a very important discussion, and as I've learned, parathyroid disease is different than thyroid diseases. So I don't know if you guys knew that, but we're going to learn more about that from Dr. Wright today. And if you guys want to learn more, I recommend hitting that subscription or the subscribe button on our YouTube channel and ringing the bell so you can be notified when we go live or have a video update for you on your healthcare or Medicare here in Nevada. Now, not everyone likes going on YouTube for information. I know you guys are watching right now. But if you want to see us face to face and come into one of our offices, here at Health Benefits Associates, we have offices in Reno, Sparks, and Carson City. And you can see this mustache in person if you want and ask us questions about healthcare, Medicare, anything you need help with. We are here to help. Now, that's enough about us and the YouTube channel. Let's talk about Dr. Sharon Wright. Dr. Sharon Wright, she is an expert in her craft. And when I say that, I really mean it. She does over 500 surgeries a year. I want you guys to think about that for a second. 500 surgeries a year. That's more than one on average per day. She actually did 3 this morning, which is unbelievable. So she is fresh out of the OR, and she is coming in hot with her presentation today. She also told me that normally she does 7. So that is that is a lot of work. Now, she learned a lot of this from Lehigh University when where she got her Bachelor of Science in 2003, but she also got her Doctor of Medicine in 2007 from New York Medical College. And when she moved here from Oregon, she moved here with someone else. She moved here with her husband, Nick, who is also a doctor at Western Surgical Group. How cool is that? She gets to work with her husband. I mean, that's like the dream team power couple for a Western Surgical Group. And I'm sure we'll hear more about that today. Now, at the end of this presentation, we will be doing a live Q&A to get your questions answered by Dr. Wright. And if you have a question, make sure to leave that question at any time in the comment section below this video, and we will get your questions answered towards the end of this presentation. So make sure to stay tuned until the end, and Dr. Wright will answer your questions as we have time for it. I think that's about it for the intros. I don't want to take too much time away from Dr. Wright since she has a lot to talk about. So I'm going to send it off to her. Dr. Wright, can you hear us?
I can, Matt. Thank you so much for that wonderful introduction. Well, thank you so much, and I'm really proud and excited to be here for the kickoff of your guys' project. Thank you so much for inviting me. So like Matt said, I am a general surgeon with Western Surgical Group. Western Surgical Group is the region's largest general surgery group, and we have specialists in all areas, including endocrine surgery is my specialty. So for most of your surgical needs, please come on over and see us. We take care of all sorts of surgical problems, and vast majority of us are fellowship trained in our areas. So, and we all do, many of us do more than 500 surgeries a year, and we're looking forward to meeting you. So today I wanted to talk about parathyroid disease, which is a pretty understood problem in the community. It's not uncommon, so I tell every patient that I see about 1 in 1,200 people in their lifetime is going to have a problem with their parathyroids. So I'll talk a little bit about what those do. So all of us have 4 tiny glands in the front of their neck, behind your thyroid gland, unrelated to your thyroid gland. And what parathyroids do is they control your body's calcium, like a thermostat. So you have 4 glands, all about the size of a grain of rice. And about 1 in 1,200 to 1,500 of us, for reasons we don't understand, 1 or more of those glands will start to grow, pump out inappropriate levels of parathyroid hormone, and it drives up our blood calcium level. And what that does is it causes all sorts of downstream symptoms based on where the calcium is taken from. So when your parathyroid is grown and pumping out too much parathyroid hormone, that's called primary hyperparathyroidism. And what it does by resetting that thermostat is it inappropriately tells your body to pull calcium out of your bones, out of your kidneys, out of your gut, and drive up your blood calcium level. And so the way that this is most commonly diagnosed nowadays is in your primary care office, you should be getting yearly blood checks, and one of the things they check is calcium. So most commonly nowadays, rather than noticing the downstream effects, the way that it's diagnosed is by an elevated blood calcium level. So if in your past or in your history or on your blood work that you have this year, if you have an elevated calcium level in your blood, which is typically higher than 10.5, that needs to be addressed by your primary care doctor and needs to be worked up to see if it's a parathyroid problem. By far and away, the most common cause of high blood calcium for outpatients is a parathyroid problem, and so that needs to be worked up and not ignored. So if you have elevated calcium, what your primary care doctor will do first is recheck your blood work to make sure it's correct, and also make sure that they check a parathyroid hormone level and a vitamin D level. All those things work together to help control your body's calcium. And so if we see on your blood work that your calcium level is elevated and your parathyroid hormone is elevated, we've made the diagnosis. That means you have primary hyperparathyroidism. Now, not everybody that has primary hyperparathyroidism needs to have surgery right away. And so a lot of what I do is I help sort of see these patients, complete the workup, make sure that I understand what the downstream effects are on your body before I decide whether or not surgery is indicated yet. So some of the things I will check is I want to see how long it's been going on and how it's affected your bones, how it's affected your kidneys, how it's affected the rest of your body. So one of the first things I will do, besides checking your blood and making sure that your parathyroid hormone level is elevated, your calcium level is elevated, and your vitamin D is normal, because sometimes low vitamin D can masquerade as a parathyroid problem. But assuming that all of those are as I said, I'm going to check a bone density because I want to see one of the first places your parathyroid is going to pull calcium from is your bones. So one of the indications for doing surgery is if you have very weak bones or osteoporosis or a fracture resulting from osteoporosis, that would be an indication for surgery. So oftentimes I will order a bone scan or a DEXA scan to see how weak or strong your bones are. So that'll be the first thing I do. Second thing I do is I want to see how your kidneys process calcium. So it's a very glamorous thing I'm going to ask you to do, but I'm going to give you a jug, and you have to pee in that jug for 24 hours. And it helps me see how your kidneys are processing calcium, and it helps me see how much calcium is in your urine, because if the urine calcium is very high, that's another indication for surgery, because that means you're at risk for kidney stones. So another downstream effect of parathyroid problem is kidney disease and kidney stones. So if you have either one of those problems, that is also an indication for surgery. Next, I'm going to check your anatomy of your thyroid gland and your parathyroid gland. I'm looking to see if I can see which gland is involved. So remember, everybody has 4 glands. Vast majority of the time, 85% of the time, it's one gland that's involved. So I'm going to do some imaging, an ultrasound, and some other scans to look and see if I can see ahead of time which gland is involved, because it helps me do a more targeted surgery. So again, if you come to see me and you've got high blood calcium, very weak bones, kidney stones or kidney disease, those are all indications for surgery. One other indication for surgery is a little bit harder to measure, but in patients who have parathyroid disease, you often will have neuropsychiatric symptoms. So things that I can't measure, but I will ask you about is your mood, metabolism, energy, fatigue, brain fog. These are all downstream symptoms as well. And so if you're having debilitating neuropsychiatric symptoms, that's another reason to discuss surgery. So quickly, what does the surgery entail? Well, the goal is as simple as it sounds. I need to go and find the overactive gland and remove it. Again, 85% of the time it's one gland. So with the preoperative imaging that I'll order, oftentimes I will see which one of the glands is involved, and I'll do a focused surgery where I go in and find and remove that enlarged gland. In the 15% of people who it's all four glands, oftentimes I will have to go and remove. In fact, this morning I did a surgery where I removed 3.5 glands, and I left a piece of the parathyroid behind to do the job of what all four were doing. By and large, people are very, very pleasantly surprised about their recovery from this operation. Doesn't tend to be a very painful operation. Most people don't need strong pain medications. Vast majority of the time, people can go home the same day of surgery, back to work fairly quickly. In the people who have weak bones, then the endocrinologist or your primary care can help work on building your bones back up. This would prevent further kidney stones in patients who present to me with kidney stones. This would help at that point after you've been cured of your hyperparathyroidism, you can start to work on improving your kidney function. And in the patients who I see for the neuropsychiatric symptoms, what's super interesting and fulfilling to me as a surgeon is how quickly people can get better. I've had people wake up from surgery basically feeling more like themselves again, more energetic, less brain fog, more energy. So that's one of the reasons I really, really love doing this operation. So bottom line is, if you have elevated calcium, don't ignore it. Make sure that you see your primary care to discuss it. And absolutely, if there's anything I can do to help and help work it up, come on over and see me and I'll help take care of your parathyroid health.
Awesome.
Any questions I can answer for anybody?
Well, I think we have a good amount of questions. I can see some questions in the live chat from YouTube. And before we dive into the Q&A, I learned a lot today, even before when we were catching up, before we went live. You are just a wealth of information. So if you guys like this topic or you enjoyed this, make sure to like the video so we can bring you more topics like this in the future. And I'm sure Dr. Wright would love to join us for another discussion, maybe about thyroid disease, which is different than parathyroid disease, in the future. So, now let's get into the Q&A, and I do see a few questions here. So the first question I see is, how important is family history with thyroid disease? Will everyone in the family have an issue?
Really good question. So as far as thyroid disease goes, what you need to remember is thyroid disease is very, very common. It is less common for it to be familial, but every time I see a patient who has a thyroid problem, it's very common that it's in the rest of their family members. So what you should be aware of is that it is very, very rarely runs in families. It's just a very common problem, especially hypothyroidism or low thyroid. So the way to check your thyroid health, and your primary care can do that, is just by taking a simple history and physical and then checking your thyroid hormones to see if they're normal. But by and large, most people don't have to worry about a family history. There are some rarer syndromes where thyroid cancers run, but all of them are quite rare.
Awesome. That's great to know. And I hope that answered the question in the audience, which we have a few more to go through, and we still have plenty of time for anyone that has questions. You can type them in now, and we'll get some answers here in a second. The next question I see is, with this disease, what age group is hardest hit, and are there more women than men who have this?
Very good question. So to be honest, parathyroid disease can show up at any age. It certainly is more common as we age, but absolutely, I've taken care of patients as young as 30 and patients as old as 90. As far as what was the second part of the question? I apologize.
Oh, you're supposed to know this stuff, aren't you? No. Or you're not listening?
Just
uh,
have I play a doctor on TV. Leave me alone.
okay, okay. Is that on Scrubs
Or on YouTube. Sorry, I
Okay.
play a doctor on YouTube.
The second half of the question was: are women hit harder compared to
Yes,
men?
absolutely. So a lot of the autoimmune and a lot of these types of endocrine problems are more common in women, absolutely, and it is. But it hits men just as well. So we have to stay aware of men and getting their calcium checked and getting their bones checked, absolutely.
Awesome. Sounds like everyone needs to take care of preventative tests just on an annual basis. Is that right?
Correct, absolutely. I would recommend because nowadays, again, we can diagnose things much earlier than we used to with our just basic set of blood work.
Cool. So I guess that is everyone's tip for the day: is make sure you schedule that annual test, and make sure you visit Dr. Sharon Wright if you want to check into parathyroid disease. Looks like we have someone else who commented that this is a great topic. Maybe they want to learn more. I would say maybe the best way is just to give you a call and schedule an appointment. Is that the best way to do it?
I am more than happy to chat with anybody who wants to meet me and talk about parathyroid disease. westernsurgicalgroup.com. I spent a lot of time putting together really good educational information on almost any surgical topic you could come up with, as far as our colorectal surgeons, our vascular surgeons, our breast cancer surgeons, our thoracic surgeons, and me, endocrine surgery. Basically, any problem that you could come to see us for, I put educational information. And that's westernsurgical.com. And there's a whole section of patient information that is helpful. But absolutely, if you carry the diagnosis and you want to understand what your options are or understand what the next step is, come see me, and I'm happy to meet with you and chat.
Perfect. We also have your phone number, Dr. Wright, in the description of this video below. So if you guys have any questions or want to see Dr. Wright or her amazing team, including her husband, give them a call, schedule an appointment, and they will.
No offense to my husband. You don't want to see my husband. He's a trauma surgeon. So unless you come in as a trauma patient, but he would also be glad to take care of you as well. We do very different things.
So I guess that's my own personal question. I was going to ask you: do you guys ever work in the OR together, or do you mingle together in the workplace?
So what's interesting is we did a little bit of that in the beginning, and then we realized that it's probably better that we don't work together in the OR.
Okay, well, the dream team.
We'll leave that at home. Two alphas is okay in the house, but not in the workplace.
Yeah. So the dream team at Western Surgical Group, but they mingle at home.
He's an amazing surgeon. Yes, we just know what we do is very different, so we don't overlap too much.
Cool. Few more questions before we run out of time. This next one, could changes to a diet help with this condition?
It's a very good question. So everybody who comes in to see me wants to know, what can they eat, when can they not eat? Is it okay to have cheese? Is it okay to have milk? Absolutely. So in the same way that when a parathyroid is acting correctly, there's basically no amount of dietary calcium you could take to drive up your calcium. Same goes is when your parathyroid's working incorrectly. There's no amount of calcium restriction in your diet you could do to drive it lower. So what I reassure patients is you don't need to make any big life changes.
Awesome. And can't stress it enough, do those annual checkups. I think that's going to be the best measure you can take, is being proactive and not reactive when it comes to stuff like this.
Absolutely.
Next question. Let's see here. Looks like someone is interested. What Medicare plan works best with your office?
So I work with many Medicare plans. As far as that goes, Matt is a good person to ask about what we take specifically. I'll turn it over to you, Matt.
Okay, well, I guess I'm in charge of the Q&A now, so thank you. And yes, our office handles stuff like that. If you do have questions about your Medicare plan, you can just give us a call after today's presentation. We'll make sure your plan accepts appointments with Dr. Wright and her team at Western Surgical Group. I think we have time for maybe one more question before we end today's presentation. Let's Okay, is this a test that I would want to have done on an annual basis if this is not something that has come up yet?
Good question. So again, the annual blood work just typically includes a blood count and a blood chemistry. And within the blood chemistry is the calcium. So it's not a special extra bonus test. This is a standard test that's done yearly along with the rest of your blood work. At that time, if they see an elevated calcium, then you would do a more intensive workup, looking at the parathyroid hormone, looking at the vitamin D level, things like that. But just a routine calcium we have done, again, typically once a year.
Perfect. I also will say in the comment section, I know there's questions, but looks like you got a lot of fans, Dr. Wright. There's a lot of people saying that you are the best and that you look great. So there you go.
Give me those names, Matt, so I can give them their $20.
Okay. Okay. Thanks, Dr. Wright. Okay. And that is all that after that is all the time we have for today's Q&A and presentation with Dr. Wright about parathyroid disease. I want to personally thank Dr. Wright for tuning in live and giving us such great information. And we're hoping to see you in the future, Dr. Wright.
Absolutely, Matt. Thank you so much.
All right, perfect. Well, now that we're done with today's presentation, I want to keep you guys up to date with all of the future presentations we have, including the upcoming topics and speakers for Hello Health. As you can see to the right-hand side of the screen, we have a great lineup of topics. Our next one is with Dr. Letitia Anderson at Northern Nevada Medical Group. She will talk about good blood pressure management, and that is next Wednesday, same time, same place, on this YouTube channel. And below me, you will also see the lineup for Mastering Medicare, which goes live in September, where we teach you the top tips and tricks to keep you or to make you a master of your own Medicare right in time for the annual enrollment period. And I'll be kicking us off on September 15th, so you can see this mustache again, which I know you guys all love. Now, if you like this video, make sure to like the video, and if you like these videos in general, make sure to hit that subscribe button and the notification bell to be updated as to when we go live or post a new healthcare or Medicare update here in Nevada. My name is Matt Law with Health Benefits Associates. I've had a lot of fun today, and we've learned a lot about parathyroid disease. Thanks for tuning in, and we'll see you next week.